Hi, I'm Alicia. Welcome to Gen Tales, where genealogy meets history.
Today I want to talk about death certificates, specifically causes of death. If you prefer to read about this topic, I wrote about it previously in the Substack newsletter, and I'll link that in the description below. I'm also including links to different articles, the official guidelines for the structure and terminology and modern death certificates. It may help you understand older ones. The thing about this type of vital record is that there's a pretty standard template that most municipalities use these days, even internationally. The template includes cause of death, and this particular aspect of the vital records goes back to the early days of mortality rolls. This bill of mortality from London in 1665 was only interested in how people died. It lists how many deaths were caused by what, not who. That information would be in the burial records if it was recorded alongside the name at all. Who died, when they died, why they died. They're simple human questions. Though there are some breaks in time when the church abstracts or local burial records have that information, such as the Vermont vital records that I've been writing about over at Substack. The cards listing a death or burial sometimes noted the cause of death, and there wasn't official certificates included with those. Of course, not everywhere issued official certificates prior to the 20th century. There are now certain rules about how to record causes of death and contributing factors, and those are both national and international in nature. For example, the CDC has guidelines on how to write a cause of death statement, but the terms are from the International Classification of Disease, the ICD codes. Here's an example of a modern death certificate from the 1980s in Indiana, and one from the 19th century from Washington, D.C. You can see that the cause of death was an important part alongside identification and burial. And then this is one from an overseas death in 1923. The bottom that was cut off is about next of kin and where to send her effects with the official signatures. But again, the cause of death was an important aspect for them to note. When carrying out genealogy research and putting together stories about family history, we want to understand the extra information given by the vital records. The name, date, place, those are the core tidbits of information, but the extras, like how someone died, they tell the story. The problem with causes of death, though, is that medicine and science have changed over time. And what we understand now, our ancestors didn't necessarily know then. So sometimes the terms given on a death certificate from the 1800s or 1600s mortality roll, they seem straightforward, might be a term you recognize, but it might have meant something else. Or it'll seem like gibberish, but it meant something specific at the time. That's what I want to go over today. I have a background in medical science and pathology. I used to teach infectious disease to graduate students, and so this is a very interesting meeting of my two worlds, and I love talking about this. So feel free to leave a comment if you're curious about a cause of death you've come across, if you're wondering if it's the same thing these days. I've been enjoying these discussions. Someone in the Substack comments, the previous article that I linked below, asked about how in the 1800s they knew to put meningitis or tuberculosis as the cause of death when they didn't even know what caused them yet. This is actually a really good example of the symptoms defining the disease. Meningitis today is actually an umbrella term for inflammation of the lining of the spinal cord and brain, the meninges. That's the real name for that lining. This can be caused by the meningitis, the infection of the meninges, the inflammation of the meninges can be caused by bacteria, viruses, or even fungal infections. The symptoms are headache, fever, and neck stiffness, which are pretty non-specific unless they're extreme. So the first description of meningitis was an outbreak, or the first really accepted description was an outbreak in 1805. The bacterial meningococcal disease wasn't identified for another 80 years, and other forms even later. So if meningitis was noted as the cause of death between these time points, it meant the person was likely feverish with convulsions. It doesn't mean they knew they had an infection or what kind it was, or even that the central nervous system was the main problem. It could have been grand mal seizures is the old term, tonic-clonic seizures, the new term, tetanus, brain tumor, or meningitis. There was an outbreak of meningitis in Texas in 1911 to 1912. And that was so if you have a Texas death certificate from that time period, it was probably part of this outbreak. You can see images of a patient on Wikipedia. I debated including it here, but this is for my genealogy people, and you're probably not expecting to see some of those graphic images that I would have included in a more medically inclined video. But you can go to the meningitis wiki if you're curious, or if you want to read more about the outbreak and where it was and try to pinpoint for your ancestors. But that outbreak was so notable because the people that succumbed at that time had a very tetanus-like tightening of the neck muscles, and they called it meningism, which I'm probably completely mispronouncing. If someone got tetanus amongst a meningitis outbreak, and not everybody was being cultured to determine that they were actually infected with that bacteria, with a specific bacteria, they could have gotten caught up in that outbreak and listed as meningitis instead of tuberculosis, just tetanus. So mentioning tetanus, the distinct effect of the bacterial toxin that causes tetanus was already known, again, by its symptoms before they ever knew about the toxin. And this painting of tetanus, there's a couple different pronunciations that you can find online for that term. This was from 1809. So if this was written on a death certificate, it's probably exactly what it says. They knew tetanus. It caused extreme symptoms. It was tetanus. Now, mild tetanus could have gotten diagnosed as meningitis at the time, but severe forms were probably tuberculosis or TB was similar. They didn't know it was an infection when it was first named. Today, it's used interchangeably with consumption, but that term was originally referring to malnutrition and wasting disease. Tuberculosis is a heterogeneous condition. It has several different forms, all caused by the same infection. You can see in this graphic just how unclear the infection can be to diagnose without being able to see the pathogen that's causing it. The cause of consumption was later attributed to Mycobacterium tuberculosis. Pulmonary tuberculosis, which is what most people think of when they hear TB, was singled out as its own disease in 1820. And so tuberculosis on the death certificate means a respiratory disorder, likely alongside wasting. They eventually also realized that what they called dropsy of the brain was in some cases meningitis caused by the TB bacterium. It could have been hydrocephalus. A lot of dictionaries think that dropsy of the brain, then hydrocephalus, which is a buildup of cerebrospinal fluid. But the exact symptoms of hydrocephalus vary and include a meningitis-like presentation, as well as cognitive issues, nausea, sleep problems, mood disturbances, lethargy, vision problems, among others. So unfortunately, dropsy of the brain could have been anything at the time. The correlation of the two terms is because of how the term dropsy was used. And dropsy meant swelling due to the buildup of fluid in the tissues. It's now known today as edema or ascites, depending on the where, why, and the components of the fluid. Common causes are heart failure and kidney disease. So if your ancestor was diabetic, had high blood pressure, or had a previous heart attack, and then had dropsy on their death certificate, it was probably heart or kidney failure. Another term for wasting disease at the time, or progressive systemic disease, it's like a whole body failure, was phthisis, which, again, probably not pronouncing correctly. It could also be used as an adjective for a specific body part. If something was atrophying or wasting away, they might use that. Like phthitic? Yeah, I don't know. It's a lot of consonants. But it's an archaic term. And not every dictionary agrees on the meaning it had everywhere. But you won't see it used today outside of, there's one specific eye disorder that still uses it as an adjective and historical context. Each presiding doctor probably had their own expectations of what a disease looked like, depending on what they had access to for training and literature, and they named what they thought was appropriate for how someone died. And this is another reason that death certificates and records became standardized with an international coding system throughout the early to mid 20th century. It solidified.